Hello, my name is Claire Kiefer and I'm a student physical therapist from the University of St. Augustine. Today I will be presenting you a case on a patient who has been experiencing low back pain for the last 10 years. Low back pain is a common pathology in the United States as well as throughout the world and is associated with emotional as well as physical deficits. According to Delito et al. In the Clinical Prediction Guidelines for Low Back Pain in the Journal of Orthopedic and Sports Physical Therapy in 2012, it is the leading cause of activity limitation and work absence in the world and is associated with high cost. Chronic pain is any pain lasting for greater than 3 months, and the biopsychosocial model is an important way to approach this issue to ensure the patient improves on quality of life and decrease the recurrence rates. The purpose of this presentation is to determine the causes of this patient's low back pain and to take a holistic approach in the examination and treatment. Evidence-informed interventions will be given at the end of this presentation to help address this patient's impairments. So our patient is a 26-year-old male who's left-hand dominant and mesomorphic and has been experiencing low back pain for the last 10 years. He is an active individual who played sports from childhood throughout his high school years. The pain came on in the beginning of his high school years and he saw a doctor for it. He was told that he has a curvature in his lumbar spine. However, no imaging was taken and there were no treatments put in place for this individual. The numeric pain rating scale was a scale used to objectify for this patient his pain levels. It is an 11-point scale, 0 being no pain at all and 10 being the most imaginable pain. It is easy to administer and has high retest reliability according to Hawker et al. In Measures of Adult Care in the Journal of Arthritis and Care in 2011. This patient describes his pain on average to be a 3 out of 10, which is a dull ache in his lumbar spine, and 6 out of 10 is his worst pain that he has, and it's a sharp pain that he experiences in the morning while putting on his shoes for work. There is no numbness and tingling associated with this pain. The past medical history is unremarkable and the patient takes no medications. For work, the patient is a systems engineer, which is a fairly sedentary job. However, he tries to get up once an hour to walk around a little bit. For activity, the patient enjoys going to the gym to work out and continues to work out even though he experiences the pain. A short form 36 is an outcome measure that was used to track progress, according to Busija et al. In adult measures of general health and quality of life in the Journal of Arthritis Care and Research in 2011. It is a generic index of physical and emotional responses to pain. The minimal detectable change is 5 points out of a 100-point scale. The patient's findings for the short form 36 were greater than average on physical functioning. He was less than average on energy and fatigue as well as emotional well-being, showing the toll that this pain has taken on him, and his pain was considered to be average on the scale. So now the objective exam findings. The patient's thoracic, lumbar, and sacroiliac joints were all addressed as well as his hips. The significant findings include a dextroscoliosis in his lumbar spine. He has aberrant motion with forward bending and pain in his lumbar spine while performing this motion. He is unable to reduce his lordosis in his lumbar spine with forward bending. Passive segmental mobility tests were performed to each segment of his spine, and he was shown to have hypermobility at L4-5 as well as hypomobility throughout his thoracic spine. The prone instability test was performed and found to be positive. This test, the patient lies prone over the table with his legs dangling off the side, and he lifts up his legs. If there's pain, the physical therapist will apply pressure to the spot of pain on his lumbar spine, and he'll perform again. If there was no pain the second time, that's considered a positive test. The red flags were considered all negative in this examination. So according to Rabin et al. In a clinical prediction rule to identify patients with low back pain who will experience success with lumbar stabilization exercises in the Journal of Orthopedic and Sports Physical Therapy in 2014, found that patients who have aberrant motion as well as a positive prone instability test would benefit from a stabilization program. During the evaluation, the patient's International Classification of Function PT diagnosis was chronic low back pain with movement coordination impairments at L4-5. The prognosis is good because he is young and motivated. However, he does have scoliosis, which limits his prognosis slightly. Functional limitations include the patient is pretty much able to do all the things he would like to do. He just experiences pain with that. And the patient describes his goals as decreasing pain, learning new ways to improve, and does not want his pain to get worse as he ages. A long-term goal would be in 8 weeks, the patient will display significant activation of lumbar multifidus and transverse abdominis muscles in dynamic stabilization exercises to increase his lumbar stability and decrease his pain. So the following impairments will be listed with their evidence-informed interventions going along with it, and these will be in order of importance. So the first is instability at L4-5, taking a posterior approach. According to Cyril et al. In Exercise Interventions in Treatment for Chronic Low Back Pain in the Clinical Rehabilitation Journal in 2015, multifidus activation with bird dog exercises helps with postural stabilization of the entire spine, which is definitely what this patient needs. The second impairment is instability of L4-5, and this is taking an anterior approach this time. The transverse abdominis muscle activation via dynamic exercises has been effective in treating chronic low back pain, according to Demirel et al. In a study of stabilization exercises versus yoga exercises in patients in chronic low back pain in the Journal of Complementary Therapies in Clinical Practice in 2019. I found this study to be especially interesting because it showed that both yoga and stabilization programs helped lumbar pain patients, but yoga was better for pain relief and stabilization was more for the functional restoration. So both of these can be used to address this patient's issues. The third impairment is hypomobility of the thoracic spine, and this patient would benefit from a thoracic mobilization program. According to Hio et al. In the effect of lumbar stabilization exercises and thoracic mobilization in patients with chronic low back pain in the Journal of PT Science in 2015, adding a thoracic mobilization program to a lumbar stability program showed to have the most pain relief and the greater stabilization effects. So addressing both of these causes, taking a more holistic approach, is what this patient needs. Finally, the last impairment is the patient was unable to reverse his lordotic curve in his lumbar spine with a forward bend, indicative of myofascial tightness. Child's pose will be used to stretch this low back in trunk flexion and can be used in addition to a stabilization program as found in an article by Rabin et al. That was mentioned earlier in this presentation. In summary, the patient is a 26-year-old male who's been experiencing low back pain for the last 10 years. It is likely that his impairments are due to several impairments throughout his body, and so a holistic approach is definitely important to determine the source of pain. The patient would benefit from a stabilization program to increase his dynamic stability, decrease his pain, and decrease his recurrence rates, which is all something he's worried about. In closing, it is noted that low back pain is an epidemic that our country and our world are experiencing, and according to the American Physical Therapy Association, greater than $87.6 billion were spent on neck and back pain in 2016, so the need for conservative treatment like physical therapy will be helpful in reducing surgery costs as well as opioid use, both of which are very expensive. So thank you so much for listening to my presentation, and please let me know if you have any questions. Thank you.